I am Dr. Lindsey George. I'm an assistant professor at the University of Pennsylvania School of Medicine and attending physician at the Children's Hospital of Philadelphia. And on behalf of the study co-authors, I am honored to give you a bit of a concise summary of data recently presented at the ISCH meeting on the updated phase 1/2 trial results of SPK-8011, which is a SPARC-sponsored Hemophilia A gene therapy trial. And so the study enrolled, presented data on the first 14 subjects. The patients were dosed in 3 different dose cohorts, 5 times 10 to the 11th, 1 times 10 to the 12th, and 2 times 10 to the 12th vector genomes per kilogram. On average, patients were followed for about 2 years with a range between approximately a year and 3.3 years of follow-up. From a safety standpoint, there were a total of 4 adverse events related to the vector. The first was a suspected transfusion reaction characterized by fever, myalgia. And then the other 3 were LFT elevations, 2 of which were grade 1 and 1 was grade 2 toxicity, all of which resolved shortly after either administration of steroids or on repeat lab evaluation. In addition, there was a single SAE, and it was classified as an SAE because the patient was electively admitted to the hospital for IV steroid administration. And then last, there were a couple adverse events related to the use of steroids, including exacerbation of underlying gastroesophageal reflux and a weight gain that resolved again after stopping steroids. So of the 14 subjects, 12 subjects maintained transgene expression. And among these 12 subjects, an analysis of preliminary efficacy, there was evidence of quite remarkable preliminary efficacy with a 91% reduction in bleeding events and a 96% reduction in factor use. And then in terms of trying to answer questions that are outstanding in the field, the first 2 dose cohorts, so the 5E11 and 1E12 dose cohort, those subjects have been followed for between 2 and 3.3 years, and they demonstrate evidence of stable and durable expression, supporting the idea that hepatocyte expression of factor VIII can indeed be stable and durable over time. And then secondly, we started to analyze preliminarily our phenotypic data relative to factor activity, the one-stage determined factor VIII activity, and what we observed is that the phenotype at factor VIII activity levels of approximately greater than 10%, annualized bleeding rates were less than 1, and this is consistent with natural history data, and suggests perhaps that the one-stage determined factor VIII activity correlates best with in vivo hemostasis of hepatocyte-derived factor VIII. And then the other point was presenting preliminarily the data from the 2E12 dose cohort. So there were a total of 9 subjects dosed. Subjects either received no steroids, were reactively administered steroids in the setting of a suspected capsidomine response, or received prophylactic steroids. Again, as I previously mentioned, 2 of the subjects in the 2E12 dose cohort lost expression, and these patients were all reactively treated with steroids. And so one of the main goals of the work going forward is to best understand what may be the best immunosuppressive regimen for this vector, with the ultimate goal of achieving stable and durable factor VIII expression that's able to reliably and predictably ameliorate bleeding in hemophilia A patients.